couple of minutes, what I hope to do is to give you an overall summary as to what the course is, what echocardiography is, what the course BSc echocardiography, what we offer at the Amrita Institute of Medical Sciences, and some of the key aspects related to the course. And at the end, if there are any questions, I would be happy to take them. So, of course, we are discussing about BSc Echocardiography. This is a course which we offer under the umbrella of Allied Health Sciences, and this is in the Department of Cardiology, and this is a cardiac imaging course. So, what is echocardiography? So, it's a medical imaging technique essentially, and we use echocardiography as an imaging tool to study and see, visualize the heart's structure and function using sound waves. And we call it ultrasound. So the entire mechanism is based on ultrasound. It is non-invasive, so we are not, the patient is quite comfortable. We are not inserting any instruments into the patient's body. So this is an external process. That's why we call it non-invasive. And it provides real-time images of the heart. What does real-time mean? Real-time means as it is happening in the heart, you are seeing it live on the screen on the echocardiography machine. And this allows healthcare professionals, so the technicians, the cardiovascular physicians, the cardiologists, and the surgeons to see live what is happening inside the human heart. Now that we've understood what echocardiography actually means, so this is what is generally done. So this is the performer of the echocardiography exam. This is an echocardiography machine, an echo machine as we call it. And the patient lies on the examination table. As you can see, we have black and white images overlaid with some color segments. And this is what an echocardiographic image looks like. Just to show you what it really looks like, this is from one of our patient examples. You can see this is what the heart looks like. As you remember, some of you have taken, I mean, most of you have taken biology. See, the heart has four chambers, right? So you have the left atrium, left ventricle, right atrium, right ventricle, and you can see that the heart is pumping with each cardiac cycle, and you can see that these are the valves which are opening and closing, both on the left-hand side and the right-hand side. So this is what we see, and this is in real time. So this is as we see the patient in front of us, as it is happening in front of us, there is no delay of even a second. So why is it important? So I'd just like to take you through some of the key points of echocardiography before we take any further questions. So clinical importance. It is important for us clinically to manage patients. Why? Because it plays a very important role in the care of patients in cardiology. Because by non-invasive imaging, that is by a comfortable external imaging, we are looking at the heart's structure and we are also looking at the heart's function. So this gives us cardiologists a lot of information in understanding what the disease process may be. Is the function normal? If it is not normal, what is the degree of abnormality? And therefore trying to arrive at a diagnosis, at an early diagnosis as soon as possible, and therefore to treat and to plan treatment. So this is a very important tool, often the first tool that we utilize in understanding what a patient's cardiovascular disease may be. In terms of personal fulfillment, yes, the echocardiographic technicians in our department are fully integrated into our larger heart team structure. That means the echocardiographer is not just a person who just does the echo and just reports it. The information provided by the echocardiographer plays a huge role in making us cardiologists and our colleagues, cardiothoracic surgeons, plan treatment for this patient. So this ability of the echocardiographer or the echo technician to actually directly impact treatment of the patient and the patient outcome is an intensely fulfilling, moment in one's career. So you're part of a larger heart team, and your contribution to the heart team as an echocardiographer forms the basis of how we evaluate patients and decide on therapy, on treatment. There is something called interdisciplinary field. I mentioned that today, in today's time, cardiology is a team approach. It's a heart team approach. So therefore, the echo technician not only collaborates with the cardiologists, they collaborate with the other cardiovascular physicians, such as cardiac anesthetists, cardiothoracic surgeons. So there is a widespread interaction between the cardiologist, the anesthetist, the cardiothoracic surgeon, and the echocardiography um, um, professional, that is the echo technician. And they form a vital link in the overall team to manage patients with cardiovascular disease. So the ability or the opportunity to collaborate in in terms of clinical care and in research and in other forms of other areas of academics is the opportunities are quite numerous. What about technology? Now, as we know, technology is advancing day by day, and echocardiography machines likewise have undergone major revisions in the last few years. At our institute, we use the most cutting-edge echocardiographic machines, offering the students a chance to work with the state-of-the-art equipment and software. Every 2 or 3 years or so, systems are updated, software systems are also updated. All of this is reflected in the facilities that we offer in our department, and hence our students will have the opportunity to pursue the state-of-the-art echocardiographic machines and their accompanying software systems to analyze patients' data. Career opportunities in terms of echocardiography are exploding, because now we have various subspecialties of cardiology which have arrived in the last few years. So we have interventional cardiology, we have heart failure cardiology, cardiac imaging as a specialty is exploding, and we have something called structural interventional cardiology. Please remember that all of these subspecialties have echocardiography as one of their foundational aspects. Without a good echocardiographic imaging person, without a good echo technician, none of these subspecialties can actually hope to achieve success. Therefore, the career opportunities for echocardiography in the various subsections of cardiology have just exploded in the last decade or so. And this can be based in clinics, can be based in hospitals, and if one wishes to, one can be part of a large research institution like our institute. Because of the above reasons, as I said in the previous slide, there is a high demand for this course. It's because of its extremely crucial role in diagnosing and managing cardiovascular conditions. As I mentioned, we all know the ECG. Likewise, the echo is one of the first tests that one turns to identify whether the patient has cardiovascular disease and to diagnose a specific type of cardiovascular disease. Therefore, in all of the healthcare settings, and this is a global phenomenon, it can be in the emergency cardiac setting, it can be in the cardiology OPD setting, or the cardiac ICU setting, or the cardiothoracic surgery setting. Echocardiography has always been in high demand and will continue to be so for many, many decades to come. In terms of job stability, as I mentioned, the opportunities are increasing worldwide, globally. And unfortunately, there is an increasing prevalence of cardiovascular diseases. And in our country, there has been an explosion of cardiovascular disease, which is definitely not something which you would like to see. However, now that we are faced with this enormous burden of disease, there is a consistent and there is a very large need for skilled cardiac imaging specialists, such as skilled echo technicians, to ensure that we are able to diagnose patients quite early, accurately, and offer them reliable treatment strategies. Therefore, job stability and security are aspects which are well established for this branch of allied health science. Competitive salaries are something which are often on offer these days, especially in the field of echocardiography, especially when you are trained in a very large volume institute such as ours, exposed to all kinds of cardiovascular diseases. One can expect to be absorbed in large, cardiovascular facilities which offer competitive salaries, and also depending on the expertise that one may demonstrate during the years of training. So there is ample opportunity for career advancement, to build experience, and to pursue further education. As in all cases of all fields of all professional fields, the opportunity for continued learning is quite important. The course that was on offer here is bachelor's in echocardiography. There are many continued learning opportunities which are available after bachelor's. For example, one can pursue master's in echocardiography. One can even diversify into masters in cardiology, which is some courses which are offered in the West and now increasingly being offered in our country as well. So this is opportunity to develop oneself, to keep abreast of the new technologies, the new techniques, and therefore pursue lifelong learning and professional growth. Global reach is something which has always been a feature of this branch of allied health science, that is echocardiography, because the skills that one learns, especially in a large volume center like ours, are transferable worldwide. That means it allows you to work in different countries and healthcare systems because of a standardized training methodology that we adopt during the 3 years that this course is conducted. And therefore, one gets to know other healthcare systems and therefore broaden one's horizons if one does choose to migrate to another healthcare system in another country. At the end, why choose Amrita Institute of Medical Sciences? We have one of the largest cardiovascular divisions in this part of the country. We have state-of-the-art advanced echocardiographic machinery, which is utilized to deliver standard and updated training methodologies to our students. We do have a proven record of delivering comprehensive training in echocardiography, which is borne out by the fact that many of our graduates are now well placed in corporate hospitals, clinics, and research institutions within the country as well as abroad. Considering the large volume of cardiovascular diseases that we have, the students are exposed to a wide variety of cardiovascular diseases, and this enhances their experience and therefore provides them with confidence to image by echocardiography a wide range of cardiovascular diseases when they graduate from our system and they migrate towards other healthcare systems and other institutions. With this, I end my presentation. I would like to, if there are any questions that are there from the side of the attendees, I would be happy to take. Thank you.
Thanks a lot, sir. But before we wind up, let's wait for some questions. Meanwhile, we have Sanuja from the admissions who will be telling us about the admission process this year.
Yep.
Sanuja?
Yes, ma'am. Good evening, all. I am Sanuja from Admission Office. Today, I will give you a brief explanation about the admission process of echocardiography technology. I will share my PPT. Duration of the course is 3 years plus 1 year internship, and the eligibility is minimum 17 years of age and maximum 23 years as on December 31st. And the candidate should have minimum 60% marks in physics, chemistry, biology, and English. The selection will be based on the rank obtained in the Amrita Entrance Examination Life Science, that is AEEL. The counseling will be after the allotment of seats. Amrita Entrance Examination Life Science. The entrance exam will be computerized online exam. It will be held in the examination centers allotted to the candidates. The duration of the exam will be 2 hours, and the syllabus is based on the +1 and +2 physics, chemistry, biology, and English. The candidates will score 3 marks for every correct answer and -1 for each incorrect answer. And the fee structure for this course is for scholarship category is 1,10,000 per year, and for non-scholarship category is 1,40,000 per year. And for NRIs, 3,000 USD per year, and the other fees will be 37,150, and the hostel fees is 68,000. And the total first year fees for scholarship category is 2,15,150, and the non-scholarship category is 2,45,150. And the NRI category's total fees is 3,000 USD plus 1,05,000, 5,150. Okay, then the registration link is applyug.amrita.edu, and the website is amrita.edu/admissions, in which you will get all the details of all the courses. If any queries regarding the admission process, the students can call the admission office at 9 a.m. to 6 p.m. And the online registration fees is 550. The update will be registered through the registered email, and the students can check their emails and WhatsApp messages for their latest updates. And there are 5 steps for online registration, that is register with their emails and personal information, and third one is application, and the fourth is payment. And the students should fill their academic details and documents upload. For enquiries regarding the admission process, the students can mail at ug@admissions@aims.amrita.edu and contact at the admission offices at the numbers, that is 858166 and 858383 and 8349 and 8167 and 8153. And the examination dates are May 18th and 19th. The next timing will be, there will be 3 slots are available, and the students can choose any one day and any one slot. And last is Amrita Vishwavidyabhidam has not appointed any agent or third-party client for securing admission any programs. And thank you. Okay.
Thank you, Sanuja. Sir, I don't see anyone raising any doubts so far. I think they have understood what you have told them. And if you have any doubts, you could please come up. Attendees, anyone over there? Because they're all clear with what you said, sir. I'm so happy that you spent such a lot of time with us, explaining to us in detail about what the course is and how much it's valuable in the present society, in the present current situation. We have, as you said, we hear that there are a lot of people who are suffering from heart diseases, and this particular course, how much it is important today, and why these students should really be joining Amrita. So I'm so thankful to you, sir, for giving us your time today for the webinar. Even last year we had you with us. Thanks for all your support. I'm thankful to all the attendees who have attended today. So we hope to see you very soon at Amrita. And I wish all of you the very best. I hope it is clear that the exam, the entrance exam of Amrita will be on May 18th and 19th. You could attend any one of the days, and even the time slots will be your choice, which you can log in and upload. So I think we could wind up this webinar for today. Thanks a lot. It was a big pleasure to have you with us, sir. So thank you once again.
Thank you, Preeta. Pleasure to be here. Thank you.
Thank you, sir.